Hello, ladies and gentlemen. This is Billy Luke. I'm coming live. And before I start the program, I would like to uh, start the program with the music. So please stay tuned and help me share the video. Thank you very much.
Hello.
Hello, welcome, Dr. Malual. Dr.
Thank
Malual,
you, brother.
I just started the video, so I would like to share the video before I actually start the program. So I apologize for that inconvenience. So let's share the video first before we start it. All right.
All right, you're live already. Huh?
Yes, I'm live already. Yeah, but I just want to make sure we build the audience before we proceed with the program. Will that be all right?
Yeah, sure.
All right. Thank you for your patience. I have also seen Dr. Akuot is actually struggling down there. He tried to log in, but I think her devices are not connected, the camera and the microphone. So, so let's continue to play a little bit. Ladies and gentlemen, you can help me share the video, please, so that we can actually build audience before we start the program. I just entered the studio, so
I think Dr. Akuot is waiting in the studio. Why you don't bring her up?
Gentlemen,
yeah, welcome, welcome, Nyabalaj, welcome, Dr. Akuot. But before I start the program, I would like you to mute your background, or I can mute it. All right. Let me see. Yep. I hope you can hear me very clearly, right? Just to make sure my sound system is actually audible to all of you.
Yes, I can hear you.
All right.
I can hear you, Billy,
I
but
will.
you have a problem. I think you have to share the post actually to be in public rather than private. So if you go to setting, I think you have to put yourself in public so that everybody can look into the video. But right now you are live, but nobody's able to view it.
Correct. Correct. Yeah, I have that problem. I will fix that after that.
Just
That's
go
why
to
I'm
the right
asking
side,
people
I think,
because.
and share, and then go to your setting, and then just make it public.
Okay, yeah, I will do so. Is that echo coming from my side or from your side?
I think your Facebook is on, and then you are also in live broadcast. But first of all, you have to view the in the live broadcast. Go into this, I think, in the left hand side, and you could play with that setting down there, like make the broadcast to be from personal to you only to public. Okay. Anybody is able to view could share also, so that you could make the setting public.
Unfortunately, I'm not able to make it right now. So maybe I will do it after the show. Yeah, because I think it is set to private on StreamYard, other than on Facebook. But on Facebook, it is public.
Yeah, if it is private in Syria, you have to make it public. Yeah, in the StreamYard, you have to be public. Okay.
Correct. Correct. Yeah. So in order not to delay you on the show, I would simply just proceed and
Okay.
then apologize for that inconvenience. So, yeah. Yeah, welcome, Dr. Malual, and welcome, Dr. Akuot. Uh, Sorry, she just left. Is Dr. Akuot there?
You can add her back.
Yeah, she's not back. Okay, let me see. She's, yeah, I want to make sure everybody's ready to be introduced. Yeah, yeah. Welcome, everyone. This is Billy Luke, I'm a social media activist, and I'm independent critic and analyst on social media. I normally do social media advocacy, activism on social media, based on various issues of concern to South Sudanese in general. So that is the basic introduction about me. My background in education was actually concentrated on criminal justice or criminology. That's what I major in my academy. So tonight, I would like to welcome all of you as a special guest, starting with you, Dr. Malual, as a medical doctor, I guess. And I would also like to welcome Dr. Akuot, a medical doctor. I would also like to invite it, Kira Agur, who is an environmentalist. And I would also like to invite it, Nyabalaj, who is a psychologist and psychiatrist, I guess. So anyway, I'm not very familiar because I have not received any biography from each one of you. So I would like to give each one of you to introduce themselves properly. So I apologize for that inconvenience. But first of all, I would like to say I I am very grateful and appreciative of you for accepting the invitation to come to live program. Tonight, we will be covering uh, two specific topics. The first topic will be about the COVID-19, and then the second topic will be about the environmental pollution in South Sudan. So these are the two topics that I would like to share with you tonight. So the topic of the COVID-19 is going to be covered by Dr. Malwal and Dr. Akuot, given the fact that you have specialized in medical science. So you will be able to use this particular platform to educate the general public of South Sudanese about the COVID-19 so that they will be able to learn more about the COVID-19 and how they can be able to cope with the situation pertaining to the COVID-19 pandemic back in South Sudan and here in diaspora. Recently, majority of South Sudanese in diaspora have been hesitant or reluctant to take the COVID-19 for a reason that is not being explained to them. But that's why I will be using this particular platform tonight to present to you some questionnaire that you would be able to answer as to why vast majority of South Sudanese in diaspora are hesitant to take the COVID-19. But before you do that, I would like you to give us briefly, as a medical doctors, how did COVID-19 come about? What was the cause of the COVID-19? And why did they give it the name COVID-19, or why they call it coronavirus? Given your expertise and experience in the medical field, maybe you will actually be able to use this particular uh, platform to educate the South Sudanese about the COVID-19 so that they can be able to understand that. Recently, you have also seen the death rate has actually increased in South Sudan, particularly among the elderly. The oldest generation are actually dying in rapid number, and this is actually causing us as a community to come forward and call upon the health professional in diaspora and back home so that they can come and educate the general public about the COVID-19. And that is why I invited you, Dr. Akuot and Dr. Malwal. Once again, I would like to recognize you for accepting the invitation, and we would like you to educate us as South Sudanese in diaspora or African as a whole about the COVID-19, how they can cope with the COVID-19, and how would you be able to persuade them to be able to receive the COVID-19 vaccine, because majority of South Sudanese are reluctant to take it due to some conspiracy theory behind the reason why South Sudanese don't want to take the vaccine for some period, because this conspiracy theory is actually uh, restraining people not to take the COVID-19. So you will be able to answer some of those questions. Sorry, I just lost Dr. Malual. Dr. Malual, you may actually phrase the link again. Second to that, I would actually like to introduce to you Kira Agur will be concentrating on the topic of the environmental pollution caused by the oil pollutant in South Sudan. Also, our sister Nyabalaj will also be helping Kira Agur on the issue of the environmental pollution as well. However, Dr. Malual and Dr. Akuot, you will also be giving some input pertaining to the environmental pollution caused by the oil as well, because anything to do with oil is actually a chemical substance. So there might be information as a medical doctors how our civil population on the ground can actually deal with this kind of chemical pollution on the ground. So that's why I attached this topic to this particular topic of the COVID-19. So thank you very much. I will give the opportunity to each one of you so that you can actually introduce yourself properly before we proceed with the program. Thank you once again. Dr. Malual, you can go ahead. Oh, you are here. Okay. Yeah, welcome back, Doctor.
Yeah, I apologize for actually disappearing down. I don't know. Yes, exactly. It looks like there's some technical problems, but yeah, thank you so much, Mr. Billy Look, for the invitation.
And before we proceed, sorry, Doctor, before we proceed, the medium of communication should be flexible, given the fact that this platform is actually a community-based studio. So in order for our audience to be able to understand the message being communicated on this platform, you should give the flexibility for using our respective dialects. So I would be using the English, Arabic, and at the same time we can use Dinka in particular. So thank you very much. That's what I just want to let you know. But now you can have the podium, and I give each one of you 5 minutes to introduce themselves briefly. Thank you.
Thank you so much. Thank you so much, Dr. Brother Billy Look, for the invitation. It's my first time in your platform, and my name is Malual Mabur, and I'm a graduate from a medical school at Juba University, and I did my graduate degrees actually like in the UK and also here. Right now, I'm working in one of the hospitals in the Department of Internal Medicine, and I'm also privileged and honored to being a chairman of South Sudanese Healthcare Professional Organization in the United States. I'm a citizen of Maine. I'm married to a wonderful lady. Her name is Akir Manil, and she's an RN. She's a nurse, and we have 4 children. Thank you so much for having us today, having me. Thank you.
Thank you very much. It is a pleasure and honor too to have you on this platform. Thank you very much. Welcome. Dr. Akuot, you may come next.
Thank you very much, Mr. Billy Look. It's an honor and a pleasure to be with the panelist, Mr. Kira Agur, to meet them for the first time, and also Madame Nyabalash. Thank you for inviting us. To our viewers who are watching, I would like to say thank you for having us and inviting us here, and for attending this program by Mr. Billy Look. Good evening, good afternoon, and good morning to different people who are in different parts of the world. I am a general practitioner. I graduated from Lady Harding Medical College in India, and then worked in South Sudan, and mainly in Khartoum initially, until I came to the United States, to Dallas, Texas. That's where I am based. I am married with 4 beautiful teenagers, and I relocated in 2013 to go back to South Sudan and to work in the military hospital until the war happened in December 13. We were the people who were evacuated back to the United States. I am currently based in Dallas, Texas, as I mentioned, and currently work in Dallas. I have worked with refugees, I have worked in nursing homes, and this is my home-based area. And it's always a pleasure to do community work. I'm part of the South Sudanese health professional. I deal with the media, and most of you have seen me do a lot of work. I've done a lot of voluntary work with the community where I help in a lot of community issues. In Sudan, I worked with Mother Teresa Sick Home, which is an orphanage at Khartoum. And I have also volunteered in different capacities in the Dallas-Fort Worth area, either as a community member or through my organization, the South Sudanese Health Professional, the South Sudanese Health. I have a small medical organization called HITS, South Sudanese Health Professional. It's a different organization where I help to take medical supplies to South Sudan. And also in a different capacity in the churches, I have also helped in our community in churches. It is always an honor to educate and teach our community. And the reason why we do what we do is to let the people know and educate them so that they can make informed decision. Panda, which akamot Billy Look, yincha later rate, chawachale kula, buku ben jam COVID-19. Kubuku jamage yung yikokwa, yike pure da, bika vaccine, COVID-19 bika lo. Wamit pure buku ben, kawaya akunim, dictor kujunubin to America. O yin late yin ben Billy in the Chawachal Akal. Thank you.
Thank you very much for the wonderful introduction, Dr. Akuot and Dr. Malual. It is an honor and pleasure to be here on this particular platform. Work you kalor, only pure the red. Ukania baka kwa baka ben wet, it was initial COVID-19, or corona. Bankira Agwer, you are next. Mbro Lekot, who book in ping, lowered introduced briefly. The same thing, ability Nyabalat, Injalo. Oh, hold on. You are muted. Sorry. Sorry. Yep. You can go ahead now. Sorry for that.
Yeah, I greet you all, regardless of our local times, whether it's morning, afternoons, or evening. My name is Kir Agwe. By professions, or by my academic background, I had in public policy and management, and my key interests were economics, security, and environment, especially on the sustainable environment and communities. After that, I also pursued my master's degree in developmental studies. All these degrees were from the University of Sir Walter Murdoch University, Australia, and particularly Western Australia. I've been living in Australia for the last 15 years since I settled here from Kenya. And those years that I've been here, I've been participating in the cities on the political aspect of communities, the social, social associations, and so forth. The other interest that I have so much, and that is what I'm going to take you into. I love environment since I was in high school. until present. And I'm also concerned by the immense environmental pollution that is taking place in South Sudan, especially in the regions of Upper Nile, namely Bentiu and Meluz County. And this is be highlighting some of the disasters that are brought about by the pollution in the area. Thank you, Bill. I thank your audience and the other participants that I acknowledge that the president of our Dr. Malual, Dr. Akuot, and the other professional, Nyabalat. Thank you. I'll end here.
Thank you very much. Thank you very much, Kir. You are an environmentalist, and thank you for that brief introduction. Before we got into the topic, I would like to give our sister, Madam Nyabalat. Nyabalat, give your introduction very briefly, and then we will proceed. Thank you for being here.
Thank you.
Let me unmute you.
Hello guys, can you hear me?
Correct.
Yes.
Now you are. We can hear you.
Okay. My name is Naya Balach. I'm a mother of four. I'm a mother of three, 2 boys and 1 girl. I complete my undergraduate in medical science, specialized in biomedical. I also have worked in various hospitals in laboratory testing. I'm currently completing my master's in health leadership and management. And I'm proud to be here today. It's my first time in social media, so I might be a little bit scared. I have never done this before, but I'm proud to be here today because what happened back home is a very serious issue, and I'm here to be a voice of the voiceless of my community, Panayulit, and in general, Padang.
Thank you very much, Nyabalaj, for the brief introduction. Now we will start with our main topic so that I do not have to waste time with our special guests, Dr. Malual and Dr. Akuot, and Kir Agwar and Nyabalaj. Thank you once again for accepting the invitation. I was also expecting more people to attend the program today. Unfortunately, due to inconvenience caused by irregularities or schedule that is not going along with them, they are not able to make it tonight because this is a weekday, so we don't expect a lot of people to be attending any live video. So without wasting time, Dr. Malual, I would like you to start by introducing to us how did the COVID-19 started, what caused it, and why they give it the name COVID-19.
Thank you once again, Billy. Look, I don't know whether I'm having technical problem. I can't see anybody in the screen except Mr. Kir. He's the only one who's there right now.
Oh yeah.
Can you please correct? Yeah, exactly. Okay, all right. Sorry for that. Okay. Yes. All right. Okay.
Sorry for that.
Yeah, thank you. Okay. Yes. Thank you for the invitation once again. And yes, we are privileged to come and talk about COVID-19 and different aspects. But I believe also there is a very dire and important topic that also need to be discussed. And thank you so much, Nyabalaj. She sounds really passionate about the topic, about the environmental topic. But since COVID-19 is still with us and everybody will know, for example, or started to know about this pandemic that occurred or started to happen since last year started in Wuhan, China, virus, which is a coronavirus disease. And from Wuhan, China, it spread all over the world. It became a global pandemic in maybe around March or April in 2020. And since that time, actually, like so many countries went into lockdown and so many things happened. It is a virus that actually affect the respiratory system and cause huge devastation and huge, like illnesses in so many people. And it affects actually the respiratory system, but also affect other system as well. When it start to affect people, it have a very small window, the lifespan of that disease, it lasts around maybe from 2 to 11 days post exposure. Then you can develop or see some symptoms, and the symptoms varies. Of course, like people, we are aware about it, but we just reminding ourselves about it, like shortness of breath, body fatigue, sore throat, lack of taste, lack of smell, cough, runny nose. All right, all these are symptoms of COVID-19, and then like so many other things actually like happens and develop when it happens. Like people may come with fever, people may come with generalized body ache, people may come with different symptoms that is really could happen and disrupt the life and the well-being of people. So the most important thing that happened to COVID-19 since its discovery in 2020, of course, like it led to so many deaths, led to so many catastrophes. But the most important thing that happened to COVID-19 is that people managed to, before since last November, discovered the vaccination. So vaccination could be a hope, could be like a tunnel or the light at the end of this tunnel. We don't know whether we are like at the beginning still, or we are in the middle, or at the end of this pandemic. But the pandemic is still on. United States started to manage very well with through actually like mass vaccination, and vaccines proved to be effective, and vaccines proved to be working. I know our people back in South Sudan, there is like some access to vaccines, and vaccines is available right now in South Sudan. I personally, my brother took the first dose of AstraZeneca vaccine in South Sudan today. He sent me the card, and it's a huge success. We know that, for example, some people are spectacles. They are like hesitant about the use of the vaccines, but vaccines could be a very good tool to fight this COVID-19. Not vaccine alone. Before vaccine, people who started actually to emphasize on social distancing, on wearing masks, on hand sanitizers, proper hands hygiene, like sitting far away from each other, like 2 meters or 6 feet apart, covering mouth when sneezing or coughing, and so forth. So this is actually like the stuff that is being very, very important, and we talk about it in so many shows, because COVID-19, of course, like if it affect people, it will lead into a lot of catastrophes. It will lead into a lot of disasters. It is a debilitating disease. People sometimes could not able to walk, will be very weak, and of course, like it will lead into respiratory failure, and ultimately it could lead into death. And we lost so many people since last year till now. I believe no family member actually like has no household or doesn't know a person who passed away, who passed away from. Let me rephrase you. I think everybody knows a person that passed away from coronavirus, or you heard about somebody who passed away from the coronavirus. And because of that, we are here, and because of that, we are still educating, and because of that, we are saying that COVID-19 is still affecting people. So let us come together and educate ourselves with that. I'm going to pass the microphone to Dr. Akuot to continue in the topic, but at the same time, also like I know that when we switch into environmental health, unfortunately, I could not stay for a very long time after past 11 o'clock, but I will try to actually like maybe have one or two comments before I can excuse myself, and before you can allow me off the camera. Thank you.
Definitely, I understand that. Thank you. Yeah. Dr. Akuot, you may take over as it is given to you.
Thank you very much, Mr. Billy, and also thank you, Dr. Malual. You had asked a very important question earlier. How did coronavirus come and why is it called corona? The reason why it's called a corona is because the virus itself is a SARS virus and it looks like a crown. That is why hence the name corona. It's a fancy name, but a deadly disease. And that is why we talk about it. And the first time I remember when I spoke about the coronavirus, it was because I was interpreting for one of our ladies. And she was asking the doctor, what is coronavirus? And that is why I felt it is important that we have to educate the community. And that's why we formed the South Sudanese Health Professional Association, of which Dr. Malual is our chairman. And some of you might have seen us doing weekly videos on Thursdays so that we can educate the community. The virus is still killing people. I was just looking at the numbers of people who have been infected throughout the world, and it is really a big number, and it's concerning. And it concerns me when South Sudanese think that they do not need the virus. We definitely need the virus. I understand the concern people have about not wanting to take the virus, not wanting to take the vaccine. Sorry, right. And the reason is, in the past, I know there has been some tests that have been done. For example, in America here, the Tuskegee test for syphilis, where about 600 African Americans were tested. Some were used as placebos, and some did not receive treatment, and a lot of people died. That was one. When coronavirus came, two French doctors said, why don't we take the vaccine to Africa? And this was condemned by the whole world, and the vaccine, and it was never, the vaccine was never tested in Africa. People being hesitant, that's why we are here to tell the people, if it's something bad, Dr. Malual and myself and so many other doctors will not take it. If it's something that will harm our community, we will not take it. As of today, we have in the whole world, 161 million people have been infected by the virus. We know the virus flies around. It started in China and has spread all over the places. Nowadays, India is being hit really bad. 23 million people have been infected. 258,000 people have died. In the US, we have 33 million people have been infected. 500,000 of the people have died. And we had seen, even in our community, in Dallas, I know we had lost Mama Chwildid. I have a cousin in Arizona, and maybe Billy Luke knows him, Chola Jack. He died in South Sudan, and we even lost our president in South Sudan of the Sudanese community in Dallas, that is James Garner. So we are losing a lot of people, and even colleagues in the medical field, like Dr. Richard, who died in Papua New Guinea. Brazil is being hit. We have people who travel to India for treatment. So for our South Sudanese, I would like to say, please let us be careful about traveling to different countries. There are different variants of the coronavirus. We have seen the variant in UK, we have seen in Brazil, and also in South Africa. The disease can travel. And even to make matters worse, sometimes people use fake documents of a negative COVID test to travel. I have seen it, and people have actually sent me information about people in the medical field actually doing that, which is very, very wrong. Let us not encourage something that is wrong, because I know when I travel to South Sudan, it takes me almost 21 hours to go there. So imagine I'm sitting in a plane for 12 hours with somebody who is infected and they are spreading. We know that this virus can be spread in the air. So that virus, if you come with a fake document, you sit in the plane, what do you expect will happen? That is why coronavirus started in Wuhan, and then it traveled all over the world and it became a pandemic. With the research that has been done meticulously, studies have been done. people have seen that it's safe, and that is why they came up with the Pfizer vaccine. I took the Pfizer vaccine in January. And there is also AstraZeneca, and there is also Moderna, and also Johnson & Johnson. These are the 3 different vaccines that are there. In South Sudan, initially people were hesitant because people are still afraid that they do not want to take the virus for reasons that I have mentioned. People are hesitant, and there is a lot of conspiracy theories, of which you had also talked about last time when we talked in our program. And you had mentioned that now we had convinced you and you were going to take it, because if it is something that is bad, Dr. Malual, Dr. Jane, and Acol, who is not with us here today, would not have taken it. Let us just use simple common sense. The first people who were given the vaccine, I call Louis Panakim, Dictor, nurses. Luelku, vaccine right. Ku yinu kaka koka. Ku to Dictor kadia. Ku to nurses kadia. Ku to technicians kadia. Ku jala paramedics ku to ka. Kiya ngabo bado. Yabga aye nyuot. Chuku, will yeka luel, be chuka lum bejidia. Lum ku will chika ya chari, medically, scientifically, chika we studied, within trials chika loy. Anang ranchi ti ten ya ino, anang vaccine na gami yen, ke riem ela duar, erare, venous thrombosis. Yes, that is true. It has happened just like any other vaccine. Kula in America, anang menti inda anchi wumu vaccine. Vaccine yen mit kwa bento. So there is a level of risk, but you have to look at it. Risk, how big is it? When bapir, wala bato. Chamandia, anang diabetes. Anang hypertension. For libuluel, then, anaran lobadoy twine. For either, yaba vaccine balloon, yaba tondia batit. Yab gangwan, ba womb, kuba gil wow, etwine. Na ye karaj, kuganchi bot ang kokwa. Yen, kujala yi Dr. Malual wakor kapiet, kubu panda dik, kubu wacha pir, wanang nim kongwan. Nade, na dom twine ke kwa chalwel yin beli wen, ino kongwen kwa, ato wujunub Sudan. Fa yin kete ban koitin, ku Dr. Malual ba yin fursa bijam.
Yes,
You're
back to
muted,
you.
Dr. Malual.
Sorry. Yeah, thank you, Dr. Akuot, for the opportunity once again. And I would like to give this chance to call on our people back in South Sudan. Today, actually, like Billy Luke, thank you for inviting us. And if we are directing this video to any community, it's not just to Padang community, but to all the South Sudanese community. We are calling upon you and also telling you that from this platform, that vaccines is not a hoax. It's not something bad. It is something that proved to be effective, and we trust that vaccines saves life. I work in a hospital that has almost over close to 700 beds, and like in one of the floors that we had an epidemic actually happened. We had like from room to room, actually, like one of the floors we had some kind of infections of this COVID-19. People started not to go to that floor completely. They shut it down. And we came and we reviewed. This is after the vaccination, after everybody got vaccination in that hospital, in the hospital that I work on. And then what happened is that we checked all the staff working in that floor. And the result was actually only one staff member actually got sick and got infected with COVID-19. The rest of the staff, they did not actually, nothing happened to them at all. All right. And more than around 13 patients actually got infected from that floor itself. When we came back and we investigated, we found that the only person that got the infection, she's actually a person that decided not to take vaccine because she is not sure whether she's pregnant or not. And she actually ended up actually getting the sickness when it happened in that floor. So this is just a very simple example that COVID-19 vaccine, it is working, and we are encouraging everybody to take the vaccines. We are encouraging everybody to take also not just the vaccine, but uh, continue using social distancing, continue using, like proper sanitation, by washing hands, by using hand hygiene and covering mouths, and so forth. By this way, actually, I think we could talk more about COVID-19, but I believe we have also another very important topic. Unless there is some questions that need to be asked, we will be able to help in answering them. But we have a very important topic as well, which is environmental pollution and environmental problems. And frankly speaking, I got encouraged to talk about this topic also as well, because I personally, after I work in after my work in internship time and everything, I have finished my internship in Sudan. Very in 2004, I went and I work in Wow. And after I work in Wow for a number of years, I came back to Khartoum again, and then I went actually and worked in 2005, 2006. I work in Bentiu Hospital with Dr. Kerr, with Dr. Anthony, with like so many other people. And I worked in Bentiu during the time of drilling of oil was at its peak at that time, 2006, 2005. And then I went and did my master's degree. Yeah, 1 second. I'm coming back. I'm just like I wanted to just like talk about this, and I will be finishing. And then I came and I worked in ABA in 2008. And during my work in ABA, I was in the area of Wehda of Unity State, and I surveyed and passed through all these places. Actually, like most of the places in Unity State, and I've seen the pollution, and I've seen the impact. And in fact, I had a lot of actually my health career is working in hygiene, and also like solving conflict and health and environmental health problems. And I've seen that there is an impact and effect of whatever topic that we're talking about next, where Kier and Madam Nyabilij is talking about in real life. And I could talk into the health aspect, but maybe after giving the platform back to you again. And I just want to say that that's a really, really important topic. And thank you for having us tonight. And sorry if it took longer than usual.
Thank you very much, Dr. Malual, and thank you, Dr. Akuot. I know you are in rush because you might be going to work tomorrow in the morning. The same thing to me. I go to work in the early morning. So I want to make sure I respect your time and for being here with me for the very first time on this platform is very wonderful, and appreciate that. So I don't want to bog you down on this program. So I just want to be specific because I have some two questions to present before we proceed. Otherwise, I would have asked you more questions. Dr. Malwal and Dr. Akuot, here in United States, where you and I live together, uh, majority of American people are still reluctant. They are still hesitant to take COVID-19, let alone the African. So, what can you tell us, the medical doctors who are actually working in the hospital, uh, you know, so that people can actually be convinced to take the COVID-19 vaccine? Because overall in Africa, majority of the African people are actually hesitant to actually accept the COVID-19 vaccine that is coming either from United States or from Europe. They don't want to take it due to conspiracy theory that I wish you can actually delve into it in depth so that people can actually be persuaded in order to take COVID-19. In addition to that, here in United States, vast majority of the people are also hesitant to take COVID-19 vaccine, let alone the African American,
No,
including.
let me just rephrase
So,
what you
yeah,
mentioned.
I understand. I understand you being a doctor is here. You might
No, no,
not
no,
be given a
uh,
vaccine that is actually healthy,
no.
But I don't know, given the conspiracy theory, that's why people are reluctant.
Okay. I just want to say that based on CDC website, actually not the majority of people that they are hesitant of taking the vaccines. That's not actually what's going on in the United States. All right, COVID-19 vaccine, when they started to implement it, right now over 100 million and 30 100 million and 30 130 million people actually took
Vaccinated.
COVID-19 vaccine so far, had been vaccinated indeed. All right.
Okay.
Giving into that, the population has so many other people still, like we have so many age group that is still not yet included. Okay. Maybe the CDC is just approving by today, actually, like the age from 12 upward. And then also the majority of young people, they did not receive the vaccine yet, but they are in under process, they are under work, because when we started the COVID vaccination, it started from the age group, from the healthcare workers. They divided into phases: phase one, phase one, 1B, phase two, phase 2B, and so forth. So in the first phase, stuff like that, there was like the healthcare personnel and people work in the high risk field, like we call it like high risk jobs. And then it was given to elderly, especially elderly with some coexisting conditions, medical conditions. So it was given to that, and we had a lot of acceptance. Yes, there are some few, not many, few who are resistant to take COVID-19 vaccines. And when we did that studies, they found that most of the people actually that refused to get the COVID-19 vaccines are in red states. All right. So I'm not a politician,
That's what
not
I'm talking about.
yeah,
Exactly.
but red states mean that the Republican, okay, some of them they are antivirus, and some of the Republicans, of course, what the majority of people actually like supporting the Republican Party, actually, including some people like having different backgrounds, especially religious or faith background, especially like the evangelists, especially like among this the group that they are anti-vaccinations, and unfortunately they are not the majority, but they have a very loud public media, especially like some of them they use like churches to become a platform to introduce their ideas, and they feel like actually giving vaccine as if like you are fighting with God, we're fighting with nature. And then when people talk about like the spiritual aspect and bringing a spiritual excuse, despite there is no any spiritual contraindication from getting vaccines. Even myself, I'm a believer, I'm a Christian, I'm a born again. I believe and I trust that the Lord Jesus is my savior, and I do my best to be a good person in life. And I just want to say that there is no any contraindications, or there's no any biblical phrase or stuff that could stopping us. So this is the one of the problems, but they are not the majority. They are, yes, maybe in around 14 red states. This is actually the percentage of people that got vaccinated is still lower compared to other states, like for example, like state that held with the Democratic Party or blue states. Like for example, in Maine, we have a high percentage of people actually got vaccinated. But I really want to be frank about it, and I want to say that due to personal beliefs, due to misconceptions, due to wrong informations, due to people also they want to see others actually getting the vaccines first. Yeah, there are some few people, let's say in the military, they said we are not going to take vaccines. We are healthy people. There are few people like in colleges. They feel like we are young enough. We could not actually. We don't want to take a risk of taking the vaccines. But this vaccine is proved to be very effective. And most of the pandemic right now, most of the people who are sicker right now in the hospitals, they are young, middle-aged people who did not take the vaccines. Like in my hospital, the hospital I work in, the majority of patients that who are going to COVID ward are people who are like almost like maybe 50s or 40s or 30s or 20s, but they decided not to take the COVID vaccines due to various or different reasons, therefore ending up that way. Thank you. Dr. Akwat, you
Yeah,
can.
D- Dr. Malual, I would like to play a little bit something here pertaining to the conspiracy theory. And that is the same question we will be, recycling simply because that is one of the reasons why vast majority of the American people that live in the red states are also hesitant to take COVID-19 vaccine because of that conspiracy theory. There is also that mentality in the mind of African that a certain race or a certain ethnic groups are actually being targeted specifically based on what is actually being allegedly conveyed behind this conspiracy theory. And I understand you are a professional medical doctors. You might be driven by your ethical, you know, rules or trying to obey the policy at your workplace that you might want to protect your employment opportunity as well. I understand that, but I'm trying to do this kind like investigative, approach because people are hesitant worldwide. I can say world citizen, majority of world citizens are hesitant unless
Yeah.
this question is actually being answered. Like you said, you are a religious person. I'm also religious too. And I also understand the vaccine here in America is safe to be taken. But people have a fear or they have a mistrust that a certain vaccine is going to be designated to be given to a certain race or certain ethnic groups to eliminate them based on what is
Uh,
alleged
yeah, my
to
brother Billy, I just want to say that we are people that I'm a person that work with evidence. And if you say the majority of people, let's do statistics. If you could have it, for example, go into any website that it's a refutable website. Go and show me the number of population that, for example, like
I believe
within
you,
this
Dr.
short
Malual,
period of
but let me
time.
play this. Excuse me, let me play this before we proceed. Otherwise, I will not have this question. And that is the same question to you, Dr. Akuot. So don't expect me that I'm simply
Okay.
concentrating on Dr. Malual. This is the same
All
question.
right. Go ahead.
So let me play this. I don't
Yeah,
know,
but
you wouldn't believe it either.
African people from the motherland. I
Listen to
want to
that.
show you guys this video.
Can you hear it?
we
Is it
can
loud?
hear it well.
You must watch this video and see this video and
Are
have
you
the
hearing it?
idea of the plan and the agenda or the mission
I don't
of
know.
these devils on this planet. Here's the
There's
video.
a very the
But you
volume is
can
not
hear
that
my
high, but
you can hear me? Can you
go
hear
ahead,
my
go
sound?
ahead, go ahead, go ahead.
Okay.
Yeah, so for the purpose of sterilization and population control, there's too many people on the planet we need to get rid of. In the words of Bill Gates, at least 3 billion people need to die. So we'll just start off in Africa. We'll start doing our research there, and we'll eliminate most of the Africans because they're deplorable.
Yeah, yeah, thank you. I saw this before. Let me go back to you and answer that one if possible, because yeah, thank you. We have so many. Yeah, thank you. Yeah, I'm not want to cut it off, but because like the nature of the video and everything, I saw a lot of these videos before circulating, and I want to say that like there is no any proof or evidence that actually whatever plan is going on or whatever this person is telling, like there is like a target of mass, elimination of Africans. Let's say, for example, I know so many Black American, I know so many Black people, they took the vaccines, all right, whether in Africa or whether here. So many white people, they took the vaccines. The vaccine that I took, for example, all right, is the same vaccine that the white person is able to take. Like we are standing in a line. You don't know what vaccine and what stuff you're gonna have. You're just gonna go when your turn goes like this one. There's no, oh, this is a black person. Let me get a vaccine for a special black person to give it to him so that that person can die. So that I'm a black man, I will die. No, there was nothing like that. We were like standing in a line and we are getting the same vaccine. Nobody knows who is coming next to get the same vaccine over and over again. Number one. Number two, if there is actually this vaccine is going to kill us, when is it going to kill us? Is it right now? Is it after 10 years? After 20 years? Yes, after 10 years, 20 years, I will die. All right. But this is not because vaccine killed me, but because my time expiration date in this earth has happened. All right. Because every person will die. But like to be, there is a target like to depopulate, let's say Africa, like this conspiracy theories and everything. Not every conspiracy theory that everybody is saying is true. Not all this conspiracy theory that is right. All right. Yes, I may come and say that, for example, this vaccine is going to play with your DNA, is going to, like turn you into zombies. Some people, even they're watching some movies. There is a movie created by, I don't know, Will Smith, like long time ago, said that there is a vaccine that's going to be given to every people. It will cure cancer. And then it turned everybody into a zombie or something that is eating meat and just want to stay in the dark. And people, they believe that this is the same thing that's going to happen like that with COVID. The same thing that's going to happen. It's in Netflix. People can play it. It's called vaccination or something like that. All right. Some people, they believe, like, unfortunately, this kind of stories. But my brother, I want to assure you, this is not true. This is not right. They could go into massive debate and everything. We have an federal drug administration here, Food and Drug Administration. They approve these vaccines. If this vaccine proves that it has any risk, it's not going to be approved in the United States. There would be no way American people, like almost 150 million people and counting every day, would be subjected to that risk of killing its population because of depopulating the world, or because like the world has too many people. No, I don't think that's going to be part of the program. Dr. Akuot, you can talk. Thank you.
Thank you very much, Billy Look, for bringing that up. I have seen that video. A lot of people have been sending me those kinds of videos. I check a think of videos. You could jam in the culture. Akor bugano. Mida kaikwa. Yes, history. Achi jam there. In the culture, I take a young. Niku. Like in a man, watch a pay. Watch a ben pananimra wahid. A pinam. Warto I remember one time pan monjang na 30 year nyala ka you can yot ko wai mi la America. That is what we used to say as kids. But now we have come to America. We have become educated. A lot of conspiracy theories are being told, but you as a human being, listen to it, think about it, dissect it down, and know whether it's true or not. The number of people who are getting even sicker now are either African Americans or people of Spanish descent. That is in Texas, in our case. And the reason why a lot of us are getting sicker is for two reasons. One, we do not have the same medical system that somebody like Trump, former President Trump, would have. Trump was beating the drum. COVID is not real. COVID is not real, until he got it. When he was in the hospital, did he refuse to take the treatment? He took the treatment. And guess what? We later learned that he took the vaccine himself since January or maybe December. But he was here playing in the media. That is not true. Do not take the virus. I myself, I got exposed twice to a person who had renal disease, which is a high-risk person. He developed the virus, I sent him to the hospital because he was vomiting blood. I was later on called and told that, Akuot, you have been exposed. I was also exposed to another lady who was comatose. She had COVID, but by then I had taken the 2 vaccines. Mind you, I am a high-risk person. I was worried. And I went and did the 15-minute test. And I went to my own doctor and did the PCR, the one that takes longer time. And it was confirmed that I did not have it. So in my knowledge, I would say, most likely, I am the one who became protected because of the vaccine. Number 2, Billy Look, in the United States, as of today, 263 million people have taken the doses, have been given the doses. 117 million are fully vaccinated, which means they have either taken the 2 doses or they have taken the 1 dose of Johnson & Johnson. Now, there were some issues of blood clot. 28 people were said to have developed the blood clot. All right? Now, mind you, we Africans have a higher risk of having essential hypertension. And a lot of us end up getting a stroke. And some of us also end up, because of the hypertension and the diabetes and the lack of health services, we end up with more diseases compared to other people. And the clotting becomes an issue for us. Initially, when COVID was affecting people in the United States, they found out that there were people of African descent were developing blood clots. They did not receive the vaccine, but they were developing blood clots. There was one of the ladies who said she is a nurse. She developed Bell palsy. I have a friend who has had Bell palsy. He's South Sudanese, a Dinka too, and maybe from your area too, Billy. He developed the paralysis of the face when he was a young kid. That lady came and said, I became paralyzed because I received the vaccine. Now, this young man that I just mentioned did not get the vaccine when he was a kid, but he developed the facial palsy, and this lady was spreading this video all over the social media. Let us take what is good, let us weigh the facts, and then see. Emmanuel, I would like to say, when we come out, we are not forcing the vaccine on you. We are telling you what the facts are, and then you make your own informed decision. If you are a young man and do not have any diseases like me, you are free not to take your vaccine. There are people here in America who have refused to take the vaccine, and nowadays measles is coming back in America. Measles is coming back in some families in America. Why? Because people are saying conspiracy theories, DNA. Think of it. People are saying Bill Gates wants to kill Africans. Bill Gates is one of the people who took the other vaccines all the way to Africa, trying to eradicate malaria, trying to do everything for Africans. And now he's going to turn around and destroy all that? I don't think so. People are saying they are going to put some 5G in our body. Come on, my people. Let us use common sense. Let us think. Achiran ko buena, away kabro no wepe. Lanu ke luere charage, yen ka lom ka, ku lom ka ke yi. Ku palka ka wen bu we kwan koin. Naneng babadu, ku bay mama dia, echiraje be vaccine belum. Gwa jam kene yen, jam nyira kai ko kene yen, ku jam ko kwan ko kene yen. Achi bela lom war. Mama chen ke che yo. Yen a pial wo. Era andita wa, she's almost in her 70s. For we kokwa, lomka. Anan koke chibay the first time, ku bake the second time. Na yini yin vaccine, ku lobby, ku chi mask, ku chi tel, ku lwelanchi lwe vaccinated. Of course, lam mayar, you
That's
can
true.
become sick with the virus. It says, take the vaccine, use the precautions. Even Kowar Chikaya womb with the flu vaccine, they still develop the flu. So it doesn't give you 100%. And if you read the statistics, it tells you there's a certain percentage of protection it gives you. So you yourself will have to take the vaccine, wash your hands, wear your mask, don't go to social gatherings. Thank you. I'll stop there.
Yeah, thank you very much, Dr. Malual. Thank you very much, Dr. Accord, for the wonderful presentation you have given. We do respect whatever you have presented. You are well informed medically and professionally. Nobody doubt whatever you present. And that is why we bring you over here to our community-based platform so that you can be able to educate the general public who are actually hesitant or reluctant to take COVID-19. However, when we continue to interrogate you with this kind of question pertaining to the conspiracy theory surrounding this COVID-19, it's not because people don't trust you as Dr. Malwal or Dr. Akwad. It is because it is the overall conspiracy that is being disseminated or circulated out there that make a lot of people to be reluctant to take COVID-19 vaccine. So uh, I personally, you know, it give me a sense of skepticism as well, because at my workplace, I work mostly with Kawajat, white people mostly. I'm the only black people there. So when we were asked by our manager so that we can be able to take COVID-19 vaccine, vast majority of these white colleagues that work with me, they were hesitant, they were reluctant, and they were saying no, they're not going to take COVID-19 because I asked each one of them if they are also willing to take COVID-19. So when I came to realize that, okay, Kawajat are reluctant not to take it, so why me? You know? So there is this whole overall fear that if I take it, something is likely to happen. So what is it behind the mind of these people? That is actually, and how do you convince the people as the doctors, you know, or as a community of the health professional? You must do something at least to make sure our civil population are actually convinced. But back in the day, I watched a program on CNN about Bill Gates and Prince William. You know, they came on the program probably back in 2005. You know, they talk about the population and how this can be done. You know, this is actually what is lingering in the mind of a lot of people. Could it be it? Nobody knows. That's why it is better. But majority of us, we believe this COVID-19 vaccine that is now provided in America could be safe. But they could take the bad one elsewhere. So that's why they talk about the intellectual property being protected, or the patent is actually now being regulated to be protected so that they don't have to use the wrong coding when they distribute this COVID-19 around the world. So thank you very much. I don't want to waste your time, but I'm convinced at this point I will no longer talk about the conspiracy theory surrounding the COVID-19 vaccine.
Thank you very much. Billy, there is just a comment here by Garyang. Garyang, I would like to say, you said they want to sterilize people in Planned Parenthood. You walk into Planned Parenthood when you want to use birth control. Nobody forces you. You go by yourself. They don't go from house to house to go and tell you, stop having children. I don't know which part of the world you are staying currently, but what I know in the US, if you think your family is done, or if you think you want to space your children, that is when you use birth control. Nobody forces you. Nobody forces you to do sterilization unless you agree to it and you sign your paper. So that's what I would like to say.
In fact, medically, the people, they talk to you and they will ask you questions. Are you interested to have any children? Do you, for example, complete your family? And then the ways of doing sterilization is different. Planned Parenthood, they're providing actually like family planning, and they have like good actually like family planning contraception stuff. I know, for example, like some people also, they do for example, maybe miscarriages over there, which is actually something you may not agree with it, or I may not agree with it actually based on my faith or different things, but this is people's choices. We cannot stop people's choices, but there is actually like different way of sterilization. Even, for example, like for men, they can go and say that, you know what, I have my 4 children, I that's enough for me, I don't want any more, and they go and do vasectomy. You know, like it's part of the method of sterilization, if you want to spare the woman from having tubal ligations or something like that. So it is there, and it is part of sterilization method or family planning, but it is your choice. Nobody's gonna ask you or force you to do that. It's illegal, and it's and the first thing in medicine is to do not harm, no matter what. If there is any unethical things happening, it doesn't mean that it is also included in you know, like for vaccinations or stuff like that. But I've seen also like Mangrove and different people that they get the vaccine, and I want to salute them and thank them for actually spreading the news and coming here and talking to people bravely that they took the vaccines. I took the vaccines, my parents took the vaccines, and my wife took the vaccine, and we are not actually like having any doubt that we did the right choice. Amen. Thank you so much, brother.
Billy Luke, yin chocolate red, manror, yin chalete yada, where chin vaccine lum, kubaka belle, a shan big vaccine lum. Ren and chitom. Wuni mitya a chitom. Mitya ke ro a chikatom. Ekole mi dang run get your koro a chilo approve. Nyan
Yes.
ye kundia abula tom. Nyan wendia and work chat with all these conspiracy theories and all that. And chijam can yen akal a chigam bula tom. For nabi kaka baler shed bula tom. Na ye karaj ekacha yin mitya. For yin chale. Thank you.
Yeah, thank you very much. Anyway, unfortunately, sorry, Kiragur and Nyabalaj. I hope you might want to add something pertaining to the COVID-19 topic before we proceed with
It's
the
okay.
environment topic. Because I don't want to bog down our guests. I thought we can do the other second topic after the or otherwise. We back a year for an adder and they get in Martin Lebaglo. Dr. Malual, jam song jing, well, that's
Any jam. Any jam. Zero quarter, jam. Already enough. Okay. Yeah.
Yeah, too late.
You know.
Kira aku den ketin Martin ku janya balaj ku de ketin bag jaktin kala bakaran chan chile bu webo pol.
Yeah, nang katin yod ba Martin.
Go ahead.
Nang katin yod ba Martin. What I'm trying to say is this. With the vaccine, kingay ko monjang ayeng ya big book of they love to read books and they love to know a lot of things. So with the vaccine, what they do is small pathogen and a yetagin ku jayi kan when ye cheat up here get to so which means our immune system is like a library where library we have all the books in the library so that pathogen will stay in your system so when bien ban entwine kay yugrat angor kata gubdu izaru kachi yine be tatwanya pay so if we know how to read so well then it should be also okay to have such a things in our body so we protect ourselves. That's what I would add to it.
Thank you very much, Nyabalaj, for that wonderful contribution. Kira Agur, Nangov Martin. A topic with our COVID-19. Yeah. I hope you are mute. Errol was mute again. Sorry, but we are mute. Yeah, go ahead now. Sorry.
Okay, sorry for inconveniences. Really look at things once again. The team of doctors and other panelists. I will exert my field of specialization here, especially in the public policy. In public policy, there's what is called the agenda setting or the problem definition. When there's a problem, therefore you have to set the agenda and define the problems. The problem that I've defined is that people are so reluctant to take the drug or the vaccine. Back to our doctors, you have exhibit your medical profession. There's no doubt about it. I'm convinced to the maximum that you have a great experience that you have hands in your medical career. What I made highlight to you and one of you, Dr. Akuot, is in America. Dr. Malual might be in UK, if I'm not wrong. You came from a different setting. America, UK, and Africa, they are totally different environment.
Dr. Malual is an American as well, right? I'm correct.
Okay, sorry, yeah.
That's
yeah,
fine.
okay. I
was in the UK. Yes, I did my masters over there before moving here, and I moved now. I'm in the US now.
Yes. Given that all of you are working in the developed world or in America, you have expressed your knowledge of the medicines, your knowledge of medicines, your sorry for interruption. I got a sound here. Sorry before, like you have been seeing me going up and down.
That's fine.
But I have a family.
That's good. That's good. Please, blessing.
I have family.
It's a blessing. It's a blessing. Thank you. That's fine.
I have family. Yeah. you have explained maximally, given your thesis, the trial that you have conducted. No one, please move here. Doctor, I'm pushing you.
Palcake, it's okay.
We can hear you very
Yes.
well.
Yeah, I can do that.
You have explained everything, but when we get on the other side of the well, our own continent, Africa, where this issue of conspiracy theory of Bill Gates and other people who are concerned with the population, your expectation in America will not be the same in Africa, because in America, I sure they have examined, they have tested all these drugs, and they are sure that there's nothing harmful in the drug. And what is behind the scenes in Africa? Africans believe that Americans or other pharmaceutical companies may alter the drugs, may copy the drugs, and insert what they wanted and send these drugs to Africa. They send this drug to Africa, and this drug might be not the drug that are going to be used in America, neither in UK. About 5 years ago, there was a problem. 6 years ago, or 8 years ago, there was a campaign in Kenya, tetanus campaign in Kenya, where about 50,000 women were vaccinated against tetanus. On the onset of that vaccination, the Catholic Church in Kenya disputed the vaccinations, but the government did not agree with the Catholic Church in Kenya. After time being, it was tested that 50,000 Kenyan women are sterilized. They are not. They will not produce kids anymore. They become infertile by the drugs that was brought under the hidden sign or whatever of tetanus vaccination. What I would advise you, the media team, the audience, on the side of Africa, we have to come out with a campaign. In policy making, there's what is called nudging. Nudging is a process where you made a campaign by telling people the positive side of a policy, like vaccinations, like farming, like anything. Telling people that this one is so good if you do this, and you have to incorporate the participation of figures that are known in the community, like the child leaders, there's celebrities and other people with dignity in the community, so that people will see them and people will get convinced that if it's so and so and so, or so and so is behind this, then this one is safe. To the last point, no, please. I would advise our government back in Africa, and particularly in South Sudan, to station a team of medical experts at one particular medical facility to test these drugs. When they test these drugs, and this drug confirm the results of the other drugs that were tested in America before they were used, then this is where people will be assured that the drugs that are in America are the ones in Kenya, in South Sudan, and other regions of the continent. Then from there, we will change the opinion of the people. People will be sure that this drug is safe. If not that, then people will be still skeptical. Thank you. Really look.
Yeah, thank you very much. Thank you very much, Kira Agur, for that wonderful input you just injected in there.
Yeah.
It is a good point. Everything pertaining to the pharmaceutical company, altering the production of the vaccine, and then actually, doing it on selective basis. That's why you see
Just away.
it.
Your
But the
voice.
question is, do you have the confidence and trust that South Sudan as a government has the capability or the capacity to be able to, have a strong scientific system that can be able to, test these drugs that are coming from different
Yeah.
countries.
All right. I will talk, but
Uh,
can you
go
mute
ahead.
yourself, Childit, if possible? Can you mute yourself? Mute Kir because it's making.
Yeah, I will. I will meet them. Go ahead.
Yeah. Okay. All right. So, Kir, thank you for this actually question and concern, and it is very. Children are blessing and inheritance from God. Abu Namangror is down there, and he could say this. It's a blessing. There is nothing to be sorry, but it is something great. Okay, they should be to be. Yeah. About your question, as I want to tell you, South Sudan or Kenya or all these most of the developing countries, they do receive medications from all over places of the world. They receive medication from India, from Pakistan, from Brazil, from Argentina, from Cuba, from like from different places. Okay, and most of these medications, it's not important that the label says it made in the US. It could be made in Bangladesh, but it is written made in US. All right. What is needed actually, like in any country, they should have a strong pharmaceutical companies, pharmaceutical department that have to control and control and at the same time uh, having the quality assurance. And I believe South Sudan have a very strong, like pharmaceutical company. I know a lot of good colleagues that they are working in this, like in different part of South Sudan. And I listened and I heard that story of, like in women. I don't know number of women in Kenya that being sterilized. I'm not sure. I have to refute and verify the story once again, and I'm not sure, for example, what is the item, even at my medical knowledge, that you could inject a lady with and then make her sterilized completely. I'm not sure what is that. I know, for example, there's some kind of contraception that you use, and it will able to, like to stop you from giving birth for like 3 months, 6 months, a year. There is implants here, you could put it, and then you will be able to not give birth like for 3 years, 5 years, but permanently. I'm not sure about that, but any place has they have their own from like the medicine can come from different places in the world. The most important thing is any country, they should actually have quality assurance, and they should test the medication and should test the quality of any medications, including any vaccines. I know most of these COVID vaccines, it is now controlled and managed by WHO, and the WHO's and the African CDC. They are the one who's responsible of providing it. Uh, and most of the items that is being provided, it is proved to be effective so far. So I'm not worried about this. Actually, like it's going to lead to something else, like a sterilization. But I'm just giving you a heads up about what my knowledge. And if like I don't have enough information about something, I don't want to say what you're saying is not true. Right? But I don't. But there is like actually two sides of any story. When we have the full picture of the story, we have evidence and everything, then we could come and say that yes, of course, that company, for example, whatever it produced something that is not harmful, or if and I will not benefit or defend them because I don't have any benefit from defending them. But if they prove that this is actually like it's baseless accusation, an accusation that being brought by this conspiracy theories and stuff like that, then that's a baseless, and we're just wasting our time. All right. So thank you so much. All right.
Thank you very much, Dr. Malual. Thank you very much, Dr. Accord. It appears we are almost reaching 2 hours, maximum 2 hours. That's what I schedule you for. And I don't want to make sure I bog you down. I want to let you go so that you can go to work in the morning. So please wrap it up so that we can actually start with the next topic. And I was also expecting you to contribute in the next topic because of your medical expertise is also being required there. Otherwise, I will spare this particular opportunity tonight. Maybe we schedule another time if you would want to talk specifically about environmental pollution and what you can contribute as a medical doctor. So I apologize for that inconvenience it caused you. Otherwise, Dr. Accord, you can have the platform. Thank you.
Thank you very much for allowing us to be here. When I worked in Khartoum, the people in Jazeera used to believe if you give blood, you will become sterile. And also, when we had the school in Sheikh Lutfi in Khartoum, I remember some of the young men, they refused to take the oil. They used to distribute it to the students, and the food was made from that oil. The young men also went on strike, and they went to Garangaleo and mentioned that myung yi yen kwach myung yi nyin mangok e chikelwel kachi kwach bichadit. Okay, so wekokwa, you make the deduction whether baka nang meat whether baka chen meat where chiwe tatayim lum. I will leave that to you to make that conclusion. Lanu yan na la riyam la gam bajachi ditida. Guys, now women at a time watching a woman tetanus, a lot of vaccination had chicken yen walk. Kawaii midwar. Walk over to Ben Kawaii refugees watching a yen vaccinations. Quite week awake. I can lang me that lang me game one. Dr. Malana me game one. Yen Kechok, cock to America 10, and I'm coaching it 7, 8, 9, even 10 in the Lost Boy community. And even Kowar Bo Khartoum, I know families now get here. So make a deduction. Lumka, Tataim, Jakarut Chapial, Gilkarut etwine. Kukarku, Ebenam control. Na law wal, Lila La Panda, Kibulate, Tillich, Kukaraba, Yenke to be waiting, we caught a panagir. Welo baka generator at a low baka watch. Welo baka hafaza, a low baka watch, Benica wild outing. Ashan na law wal na legi tonkokwa. Kibula, Kapiat, Lanu, remember it's a messenger RNA in the virus. Chirabriok, a tangle Jorian, Lana Nating one, Kowan la Totayim la Gampan Monjang, I Benica Mook, Hafaza can tell it. For let us the virus now, it needs a high quality type of storage. For we ought to be like a one. Tom Pfizer, laka Tom Pfizer kulwelga walk akunim kadya nang nimbo ya wana. Na lwel masalan bili loke no wabo kwa pan padanga buka way vaccine eka lewra achin kutwet we ya wana. Wana ko chi lui in those fields alu become we supervise. Ko jot en vaccine ten kula ko yin ko kwa. Kunayo vaccine lere junub ne raikan edeken mama jawum. We take a late. Have a good night. I'm better a little bit, but later on I'm yeah. Thank you.
Thank you very much for the wonderful conclusion, Dr. Accord. It is a pleasure and honor for contributing information to South Sudanese in general. Dr. Malual, the conclusion, but how?
No, I just wanna say thank you.
Environmental pollution. Otherwise,
yeah. Okay. Yeah, thank you so much for the opportunity once again. And I really loved and wanted to stay into this important topic also that is coming back, which is the environmental pollution. But I believe the medical experts, the environmental expert and engineers, they are there. All right. But I just want to say thank you for the invitation. Thank you for your patience. And thank you for understanding the point, my point of view. And I just want to conclude by saying that prevention is better than cure. So prevention of this COVID-19, it is always better than having the disease and getting sick and like getting affected by it. Uh, Thank you so much once again, Billy Luke, and all the guests for this wonderful, like hosting us and also being patient. Um, if I could allow me just like maybe 1 minute, talk about these environmental issues. Environmental issues, if you can allow me.
Sure.
If not, that's fine. I will able to go. Go ahead.
Yeah, thank you very much, Dr. Malual. Dr. Malual and Dr. Accord, I want to give
That's
you
fine.
once again more acknowledgement for accepting the invitation. Uh, this is a platform that you need to use.
Bill, look, your sound is very low.
Yeah,
It's very,
your sound is very weak, Billy
it's
Look.
very low.
Is
Bill,
it
look, jadiro nyalamat, so that it down.
up to now? You cannot hear me?
Now
Very
it's
bad,
still
very, very
down.
far.
You have to come up a little bit.
I don't know. I don't know what's wrong with my
If
studio.
you don't use the headphones, use just the microphone right away. I don't
You
know.
yeah, your headset could lawyer computer in yota.
You can remove the headset. Yeah, headset.
Yeah, Bill, look, ko jamaban na ya kaping ayek loud. They are very good, except you.
You're muted now. You're muted.
Unmute yourself, Bill, look.
You are
Bill,
muted.
look,
You are
you
muted.
slowly mute.
Please.
Unmute
Can you
yourself.
unmute yourself? Yes.
Yes. Now,
Yeah,
can you
now you
see
are
me?
okay. Go ahead.
Is it loud and clear? I can think, man.
Angor,
Yes.
angor,
Yes.
Appearing, but very weak.
I Almem Paul ku kara ba jala fix kirot belew. Ke ka taw ke tem man kan wo chen ping pet akwai kero lo lo cha ba deri. Wa yin ke lo we yin Dr. Malwal ku Dr. Akor we lo lon pya dare le community da. Ku we chukale ko ya nyar tukulo yi zaman 19 yin ku ban ku social media activists al ba ke ga lo char ku ba communities ko ba ki ga wet ke wonte dal ko man ta ge nyuo be kule ke introduction ni lo yi ba ko ben jam wade COVID-19 wade 2020 ko gun ba ko wede ya we ga pir ko so make yourself available to the general public especially to your community dan jing a chanin a platform gane ke kere jing de pada lakini still ya junubin ko ye ko we ka ko ni lisi ogen yuzu kwa yen we chukale je daman cha yen oge we loy lon tet ti man cha ge mar ke we ko woni lui ma tai pa ban cha ga ku na mloy ke pet we bu ke ga polo we bu ke ga cha go agora anu non ga dalen ke tuan ben abe we ga polo ku bi diala no malamat dun so kene a chan we le ku yen ya nya by topic bita environmental pollution ba jo ba chol we damandet a chan de special document he one of the evidence e chi ran ye pechen ni chi le Germany was ti nga aja ku te chagen tinga ga mende men wan ti dir ke ya chek e chi la fan Germany ko chi la tem a chan bi evidence bi en new of the environmental pollution document kina to ka yen ko ya nya but we bag la law study ko we doctors medical doctors ko bag de ri chan de medical term te chu ke de pertaining to some chemical reaction ne rolo yen new of evidence ngokan so aja kuj ma buk jo be de second time we e kene we ka ke le ben chak ben ka yok da man duna ila na iran je yok re ke yen ka otherwise topic da ba liep to ko
Yeah.
ci ko ni lor ben tin ben na de ke tin be jwak tin to
Yeah. Thank you, Ben Luke. I just want to say one thing. There is a pure evidence that communities that are close to oil field, they have high risk of so many diseases associated with the oil pollution. Okay, and it's a fact. Like the Niger Delta in Nigeria, or like if you go to Ecuador, there is a town called Texaco. There was no cancer, no stillbirth, no birth defect, no anything like that. But 40 years after the oil being drilled and a lot of pollution going on and happened into the floor, the rate of cancers start to raise up. Cancer, especially cancer in stomach, in bladder, in mouth, and in the leukemia and blood cancer, started to raise up a lot. And unfortunately, one of the complications that is known, like because the drilling, the way actually like it is done, the Chinese company, especially like in South Sudan, they did not actually put a consideration much to environmental health and to the safety of the environment. Like I'm not an engineer, but if you are drilling and having this crude oil, bringing all it up, actually, including the water that is down there and everything, and then allow the water to spill down, it will affect the fishery, it will affect the animal, it will affect the human that is there. It will cause so many illnesses, skin diseases, problems with breathing, problems with the stomach, problem with the liver, problems, like in different places, like ear infections, blurry visions, irritations, and then bleeding disorders, and having also stillbirths. Kids will be born with defects, defect in their faces, defects in their limbs, and unfortunately, yinga keke mitkwa, keke ya merkwa kujala. This is our families and our relatives. The government of South Sudan and also all these companies or oils that are working there, it is our role to speak up and say that yes, we know that this oil that so many people in South Sudan are benefiting from, or few people of South Sudan are benefiting from, the population down there is affected. What is the role of defending, like the population? What is the role of bringing back the health situation back there? And I totally agree with you. There's a lot of good studies going on, and so many studies about this oil, environmental, like health, and the impact of oil and drillings on the population health and also environmental health. It is there. So I am there with you, my brothers and sisters, and thank you so much. Yeah. Mhm. Yeah, this is one of the birth defects that is going on. It's considered as a cancer. It's a tumor. Cancer is abnormal cell that can grow, in different places of the body. And here it is coming from the forehead. I don't know whether it is like brain cancer or the brain, like there is like a skull problem, but this is part of the birth defect from as a result or consequence of could be like from the oil products. I'm not sure.
Yeah, thank you very much. I think you guys can hear me. I'm in the background. I have a lot of presentation to do pertaining to environmental. I have a lot of documents, including even a well-researched document. Unfortunately, I will not proceed with it, given the fact that I don't want to bog down our guests.
Yeah, thank you.
So, Dr. Malual, Dr. Akuot, Aja Kuch, Ekene ke yamia balua present ke wetatin, o ba wing nyuak tajwid unte ke chike nyuak ke evident from the oil producing area. Ekene you consider he one of the national security threat to South Sudan as a whole, because people actually consider this environmental pollution as if it is only going to be confined to the oil producing areas. But when we look at it, given the level of the catastrophic natural disaster in Greater
Flood.
Upper Nile as a region in particular, even you have looked at the level of the flooding recently, it is actually watching the entire, oil that is being disposed out there openly on the ground, to go into the river Nile. It is actually covering the whole land. It's damaging the plant that is growing, the entire ecology is actually being affected. So the atmosphere itself is also being polluted. So this is a very complex threat, and it is not only a threat to oil producing area, it is a threat to the entire South Sudan as well as the neighboring state, including even the Sudan and the Egypt, people who rely heavily on the oil, because the underground water is actually contaminated, the river Nile water is contaminated, animals are contaminated, human beings are contaminated, the whole atmosphere is also being affected. That means the ozone layer is to be, destroyed by this toxic hair in our country. So this is a national security threat, the way I perceive it. So anyway, not to waste your time, I will leave it there, and I will see whoever is available to stay between the two of you, and then I will have to proceed with the other two special guests who are supposed to do the presentation. I'm also wondering whether they will even have time, because we have already spent 2 hours on this
Thank you.
program. Yeah.
Thank you, Billy. Look, I will excuse myself, but I will follow the topic from far. I appreciate it. Thank you for having me. Thanks. Good night.
Thank you very much, Dr. Malual. Dr. Akuot, do you have anything to contribute? Any environmental issue?
We take a late way panda. Ke chakal waika baka kwa ila kereret. Alir alobi emyong yen wait alo balir yok alo mi chadit ke nang chiek chicken nya nyuot piu aye karyoki adik buku ko kwale ago ku jal ke won pia kana ke won ka ku bikala won wen na de ke lew biki nang piu piat ku jala we ko tia kana mantika adik baka ke shirkar ka baka ya gar yen ke ka pia sa pia ku biko nyi ino e jamaa nyiku kalwai ka a waj bai ci pie ci man bai to wakatin ki cir kana ci lebura loy wed wona nan ko wona ko ku bi ka benjam about the ozone layer, about the environmental pollution yen ke dor duan fa we ko ci pie ci man yiki ragwer jam ka dun ka bit loy ko ci educated ci man yi bankir ku mit kwan ci ka ya bai ka ya ciek yen ke wokin wani yi social media yen dik na neng mi chika ya dit ku chi ko ken chika gam bika ya nyuot in the social media ken ke dulwen na de lo be no ko pioj Sudanese rareby ku chinda abu ku mar ken chindwan ku bika chirka ka bika ben chikoro be ya loy we chaka let an bedai bang pin mi cha chi ben bang ko ba jam ken ke choya lakini an bedai pin pa we chaka le chare ben look loy lon pier loy kunyane abia token week wadia we ko to Australia ku ko kwanta America ten nyale abu we yating kunyale abu kongo abu ka yating anan ko chikal yawnin ci man duwana we bu ko pioj ku ba ko le na ye ka buga am ki we ku water and jahis bagan at any time na nen ko in beloy tan ko to e mantiga ci lo affected we chocolate nyala cha boya ting wa ba yo kol thank you and mong ngot kan ping ba sa na jam kan mi ka be za loy
In
thank you
Chale
Thank you. You need to play
Dr.
it. Thank you so much for your coming.
Ay chugle jaret Dr. Malwal in chugle jaret we ba pal fursa ko bag bala nin yi yene bala toji ye lakin the rest of the guests they talk ke special guest ke ga talk yi Australia ko pinde na Europe pinde ga kol ku yene ye damande na chila yin in Dr. Akuot ku Dr. Malwal we chukale ben chak ben ko bede damande bo be jam nyal je bo tie we chukale
Ian, quite chicken chill to be look to quite jam good there.
ai banya toji mi jo ben a chanin ba topic ba jo lo introduce tere kaman ko in taw ci man taw bankir ku ja nya balaj yin te lo
Okay, after that, na chuko chuko jam yan with chamo with the gato kan ben chao ben yan mit pure red yan asulu yan we go join with pollution achan ding tin ba Martin chan yana ran ba iten an to pongoi ku yan chilawan ba cha ting we to en ke pollution lu chi oil chena pe chama won yodin so in we de gidin tin ba ben Martin kan pollution kini but the chi jam to ko cha le red na ben chao ben ba ko ben yan awareness you know ku jala wa ko be chao jam tin kene to ngale di red ko yena lui media achan ku boko te be yena wana brand I pan le cell phone day ku be ping long africa kloro asul ko ti ko long ni ana de wo te gam ko ti chi ding pen ku chi piu chi pin tiong ke community e ben ku gene chin wo gal yin wo bi ko we pu ko pe de pe nyapu achin pe nyapu ni wo $200 or $100 lakini ko ti ko blind full ke ye ko bi jam la ga bi ko mo bi den pung now because big deal coin yen which a lady ban chow ben we chow jam what COVID-19 kuja yen with pollution my thank to you or maybe I may see you again yeah back to you Bill.
In chale jared banya coach ma lai ka jin interview dun te ko te chu ping to big ban chu dai yin ban ni chi padang pan kana yen ma lai ka jin interview to the cake ke wadun chu ko to ko won te masajeli yen ko da man Dr. Acol in chu le jared yin akwaj man bijo lui log out wala barir page like na ti gapi jago
And we are logging out. Kuba ping from down.
ai na de ki number la wala kala bro dok ke na in case nong in ko luil ling
Hey, thank you.
chokran chale ai bankir ku ban nya balaj wakta kale ji wata gur palpin ku chapin kaman ko ke ya yegi taman achan na go ke chablo ka jalware kene ka yuke platform dun ko we mi ki community ku ya ke ban community ku ya ke ko ke pi ke community kene kene ke ku dun fursa kene abigio dong ko we ba ka kene ba gen jobe dem lakin before ki jogu ko sit ba ka lim akwai na cha daman dun ko wonde go ye ka pal ke en ga wach ke kaman ko ke yuke yike fursa ko bigi kene bi kon gwir bitok bang te COVID-19 emantine ya nya bag jo jam bang the environmental pollution ke we mi ka bai ko bag lek jing anda iban ko jila junubin lakin ga yok document talk a very complex document talk including ke slide show talk ye jazz lakini ya ting dama na chika bo dak ku ye ne en real way so be considerate of my time as well okay 2 hours the chuk lo exhausted already so e ya limala ku le ye ne chipiat dama nang ku be lo continue che ga weekend na ya ku week nu bag la twing ku bag introduction bag loy bu yo ba ton to ko det kene ba lim way ayen in ya bala ku jela yen ban kira gor wak ba ke je fursa ko each one of you be there ko bi loyal ku bug your thing bila twing wala kibla twing
Okay, da beni.
ini ben ay ini ben la twing
Ai iran ci da bele look ko wat ko to ko dang media group ama jam to ngien ke joy ben taw chin ti ne tinga da no ko ke inde ko pola chan loy ne twing inde ko pol ko bolo ko bugbe ko dang pe kwa yok achin kidit today 1 hour or less than 1 hour to ka yoga the man kana adit chaka and it is one of my dissertation di could learn in learn jam thin do not take minutes ka yok today in 1 hour half an hour could gam quite ka do
wa ba
to
jin we lakin ke yan ya a very complex red in presentation bro loy en ke yan we lim so ya yogo no topic adi red kun ka ko na again tinga ya very patient other guest ko ye ne yen be a fashion we chi wuj ba we loy humiliate zamana chan we go da we tu we ke special ke we guest ko ke ben wa yen mila twing kwan brer nya ba like to stand by queen chuk le ye ke dang chi rot pal pin queen ga wi ko ko lui queen be good anyway.
Okay, then beyond my opinion, kaka luel achan loy edit loy twin. Kaka luel adoko pol kubulo kolpay. Ma right kagan kaki.
Ka back side would be nen baga available abi nya ba la be ke da lui le ko kan ko lui le ni queen ti.
Nyabala jekede
I'm only left with 20 minutes to do something else.
Correct. That's what I am concerned about. Nothing I. Banki la twing.
Okay, Ken abuk pol kaba loy. I will just give an introduction of oil first. Oil gone this Sudan. Kubugo pol introduction with oil ko exploration. Kujoko pol ten kujoko ben impact for the next show. So that bula kulu.
Absolutely.
Aku di bina pol and they jam the history of oil.
Sorry, I in terms of banki. Before kicking a low introduction, nya ba like ke jam le in ki dong 20 minutes to be just. Kuyen after the ba we your time ba road better prepare but yin and been available. Nya ba la bang evaluate. Ba yo nya ba la available mostly. So yin ni ke
So
dang.
I can hear you very clear. You're not clear to me.
Yeah, Bill look so do very lower.
So the actually okay like twing yang chak and ping ke ki ri jam.
I saw do che clear I think mungkin da sama baby ko bete pada ya. Na de ben na clear.
Okay, Billy look and you know the man change ngoberan team nam miak wale tad ben ken lu and imbe lu tabao for the tomorrow night karang tomorrow kuja Saturday lu en tabao ku in ba lek tilawan en kada lu ka kana.
Okay, thank you, Kira. Gur aya yok nya bala jale bila twing deng tin balwel before ken jala ni judo 30 minutes jan yen topic kana betaw le yom nan kiman ci Kira wel ba time below ke bil luka de nam issues ke ngade nya bala jina bagam na deng tin balwel before ken jal ko book bu bil luki cho jolok yo.
I feel work by we quite die with you. Children won channel come really no. It's my first time to come live. It could be the pay, could be an buy. Could you call you by back home? Wo quite aware. I look book nin coach ne kuyo quite qua. Yeah, the joke with our panda pan are work in a hand pick. Coach chinwan chin kunwan ke kunwan wo come on at the same time. Kalau achin loy ban jama pay the whole thing about the pollution because zaman dia ko pay ko le biya ke pet bu koy kon jam about the background until lu ran ke jol pollution but kala balwel in 2009 and achila malut at that time kri bana ngot ke jidit non ko je ke non bay zado so won chala ne kite palu ke kie chol shaham acha ting pin chia ta ga shara la ga te ga lel pin kire so I was very concerned and I ko ban yo quite kwa ke yak tin tane che kapat in 5 years to 10 years time ko je big to bay tane pay ke kien la ga yedol che jam kawaja ting tien jam tina kawaja yen mo ko jayo ten people were teasing me like they were having fun of me because kitchen lake yeting ke jam kawaja ku ko wan en chelwel en kichira dile man ko chakting ting de akay be ting ne kala ka chakting ne kraj ku kwa chibu ko jeten wen mit ka bay te kay wodim kempin ke kene ke ba tol nyin ku ba bedial dum ke panchi riaw pin um companies e ban kubik loy ban loy thì thiếu coi cái bài của ya coi cái trục cái chính cái niềm riêng I'm sure that when you are tin ana woni budget ci yeke bi ga loy la loy ku pane ko le penye business rana ban na wi bi kri da ta jam dai kuna ci ga yek a certain percentage a chan bi ga loy ban loy ku yugo ko bai ke ko len ci ga tej tit ci ga tej lek ke kele buk loy lu bi wo ke ta je pe ku nin knyal so when we ka bai kri ban ke na ko ta mi ta di ka ci pet a chan companies a gok ayan we gok we koy mena musulin lano queen bi ban tok bay pandu a chen no mi chin ki mufta ga ma cham ko lawut ke we danim riel lo ba koy we de ko lo ki united ku tenga ten kana we gana kala balla we ga ko na ko be ban bo ban na ban be lo ya be jam we ku ya ma jam ka bi a kala ban Martina where I no asi this is hard ke quick way or quick solution na book loy ku quick solution ta loy we koy wona we ci ga dong we bañ we ci mit kuna jot ku leer ke Nairobi leer ke Uganda ku jelagan ko bay kana a solution lana ko cin gudra bi ga jana kala gan ko ke bay arer ke bay ko to ki ku wut taw kala tin cin man taw la yu Nairobi yu Kenya we ga ci bay la oitin ku bay ta ke ga oj first of all we ga ken ke lu recognize bang nang citizenship we ga rere only ka we ya ko ci hu bay ku tek dang ma kuma le be war anytime ku tok we ku ngor ku duk wun ci alu polluted so ke ka ci ka ke ga lo baga take ko bu ko be wer ko nyakol pe wo be jam tin pe
Thank you, Nyanka Nyabalai Noel Tikalwell, Yoga Ping ko a very tangible message, the kitchen queen can Lano, Ran, Chap by Loy, Nairobi, Columbus, Kugartan, Nana Mendun will Chinya, Kaban by, I can be quite Ben Pure, you'll be Banaban. Kayin to Ben affected there. So, the same thing, I'm more correct and Kayin Chale, Will Tikalwell, ku time book your be look, be your schedule away. Bak jo ben jam mor ne kan lan yin ni ci la bay ko ci tinki mon ci ko ni ci lejeret war ci daman cour alla bu ko la ke Louis Ten met won bu ko dil ko pio ay ka we ka yelo yo ya ka wajat na luy jam ne kan ko lu jale e yin ci le ko thank you very much in chuk le ne ben cin ben ko na bil look ci ka ya clear bi la thank you ne jal bin jo jam bil look are you okay there
ngane okay cha ke yan pengo man ci law.
Oh yeah, much better. Yeah, alaba nya balaj ba jo lek yen chan yen je la ci kede jwe.
Mai ke mute unte ke mute chane mai den to fi laptop nin e ci lo reduce to ko ci lo america ko na ken ping ke law de man ke lo gi.
I work low but it's better. It's better.
Okay. Ke yen nya balaj in le jeret ba nya balaj in le jeret jidit ke di kin zamanu chine nom ku bo yani le jeret ban kira gor te le je ben chak ben chak zaman dun chak nom ku bak berer ku ki program ka ki ben tol nam loy ke taw wo ba ke yek fursa ku bag ro jo bele gui ku kam nya ko le man jie mo bag daman bag dom daman bag available ang nye Dr. Akuot ku jala Dr. Malual abig da show le miak show den ke lo regularly on Thursday it dane which is a Friday to dun pan Australia so yin chan ya ba show ko ben yok lo ne le miak ko do ku da show den ke di to ko community dan te ben ke to ke man bok de bok gen yo dom ko na bang nim lao Friday en ki regular show ka padang ke ro lo ti ku lo yi yom te ka ja ku jin banya ko na ya ken ya bak ta barnamij ko yin the whole presentation book ban loy ke suppose book wa loy Saturday ku pal ko man book loy Friday bu ba ka ben os nya bala ki la kira gor
Yeah, it's a muskala. Can I important Saturday a book poll or a book tit late ku bigam cake. So kala bitaw yen el mem bankir agora be last point of the will ku yin mi jo lui contact with cake ku baka jo lek pinu sa camp Saturday.
ai ke ya nya de big luel ne ke ya nya big luel ne yin nya bala ja ko be available almost every anya jina me daje
It depends. It
no
depends at what time on Saturday. On Saturday, I have something else to do, but I don't know what time you guys would like it. If it's like evening time, that's fine with me. But morning, I will be a little bit busy.
Okay, yena ya lwel bil local bapola ya ko ba jolo kon cha da ju ga ban ga padang ko ba ke ge ba yop chen ko jaga yen update na Friday night dem piet ke wala ya tu yom men ba ja ba nyok lu lu ne ja su ba jo yop chen so ya yok nyan kra nya bla jelo bu pol blo ban ki ri ne lu bu gam las ngata be lwel ya
ai ban ki to
thank you nya
Okay.
bla bu o ba yok rom yi ya
Okay, shukran.
in chuk le nya ba
Wek pengene.
ya in pungo di ga go ahead ban ki
Kato wek leje wek bany. Brother Coach ko Willie Look ko Nyan Kanyabla ko other panelists of doctors Dr. Akuot ko Dr. Malual. Kato banda kene jat bayar yo kene ketija gok ko ke achen goyrun kadyak chan ken research ke kene ache ko pioli ke ko bu ko jam chaka jam bela guru kuma gop achana kuma ku shirkat ke da agreement wiki jabba kwen ka dan tide ko ko ba de ko ke jabar lich achi tong ke jok de wo chimani ko che corona virus ben chimane ma corona virus man kegel achana tichen lo yubi yaga kupinya tiok be chira la ten wala yinde kat bila te wene sep ke kenindo lekin en jong de jago che jong achi jong de wo ba chi de wo ma lut ko chi de wo unity region achana jong ke ko dom piwi ko dom through creation achan pin piu ken e ka wal pin ke pin la mol ku radiation ko jot pin ayir ran kai e pin because e pin en tim ku lay ku ngaben wo jog dom ti len ben biag de ko ke mitad ke to de ne ke achan mit ka ken e chik ke e tiok pinam gradation of metals like bariums, leads, and other radioactive materials or metals. They are too intense from the ground. Woman that I can turn wopol. Me the big walking. I mean, a age of teen and whatever. Kukiranto, Kranchi, 30 be true. Quite the tom man that. Kiratoman. I can clearly apply. 10 came with war whooping meant the 3 years because made is too short. A tweet the pink in you. Can a colloy. A colloy. Can you have a polia? And I call the man ban in God from the history. Go away, Jack. Who health aspect, the job, health impact, socio-economics, environment, Bakaluin is systematically I can look at learn. But overall, going the question job, I don't tong in cut, could you in cut. Lekin just can a few could a jam cake, who my cake, could ding that, heading hook. Ding koye train goal pin one, well pin the term Kali or Pinodoro. Kuruntu idatu kubeko ilo ulele kidenge te yuan pinandoro kale chot benebet ibini inde ap chom pinanda tem wal pinandoro ulele dengwan ketwin pinandoro en ka chum ke ba de denga be ga ba denga be after 1 month and a half kerap chi chom nere achi yom ke kene e ke ber complex ele buka long bubina le long adang de le bi ko yi ko tope ke na ba pole ye ko bi lu en contacted win ba la gaman lawan ma le ma lawan achan ngi man ade kok you get that all about the lawyer. I expect that behind this time bogen jo law in show, but we you can message you. Okay, can is an issue of concern and chiben tabes kang about 2 hours. Kula la lawyer at 7 ku go at 9. Kain we kwa polio werke we kale ku mo ko chintin and we ko ite.
Thank you banyak gurin jalle jere no welte cikalwel mem daman kana blue reserve lan ini bol waya cuman cinulwel yani kreli jere ta chan brand ben loy ku ba ko lo ci jam lan jam da de loy pe mem kana go gale celwi di pio bai ru ba bai ko yen kana bi na mem alay di ca dogi na ret ku ja ko mun pin ci ban de kadro ko wi ca dogi ma lay bari nyan ka nyabala bil luk ba jo nyayin ku batio.
Thank you.
For the wonderful appreciation and gratitude to extend to Dr. Fonunte Ben, Dr. Fonu community, Dr. Malual, Dr. Akuot, Kujila Yin Ban Kira Gur, Ban Yabalaj, which is a lake, the man one chang nom, go with lake, Yellow got the family school. Yen Banya Kojo, Kojitan, yen and the boys straight from Waka, Yan Key Conde, Aman Yiran and Chico Tograj. Akato, damana bug yo dam izin banki ku jaban ya balaj ko bujo ba ben jam tani chaga yin next week ku no topic ne ke very complex red there special document ko ba ke koy week bakaro dwake talk yen ku slide show wone powerpoint presentation abro loy ke ya nyuo ke ne just pictures lakin ban me tek tek so bi tawno won unfortunately yen a kika so because there was a technical issue when ke chi nya bala chene request karanga kai to yin apiat na jara na jam ke bingi ke ko bin jam tin ne ke wa wecha kale kada bet ke bu hosting bu lo lekin much of the presentation about lo ku bu ke yo a guy ku yin we kai ko ndai a to ra do na ke tin ji mana yi ne graphic den to karanga ne be ke ga plain e ngoyen nyuo de ne ke ne ngoyen information ngon lu contain abluo charawu e turar una ke ting abia pedi jadi ku ka binyo ku ka bluo charawu e dam la ngou ku dam ne ku ngoi loi ke pin loi di wala chata me ti loi di mane to li na ke ting ke dom wan ti ja ken mai dom wa ka chiri ka ke yom a li re yer yo ke man ti doctor ko ken luil ja ma ka ti kan ke ti doctor ti ban ti abala ken luil na de ki yin ki den cho let ku jela borium e ka ke radiation e gi che jor nyal ret ke ko ko te wan ke ti lo dam wan ti malut manu te ti nya bala chene lo ni kwa ka ke bi ke jam detail kwa ka ke ngi ju ke because the chene first time lo ko bokosi on ne kene kwa yen we ko ko ndai ra ne to ke special guest ke ki ra gor ke environmentalist you can environment but you can public policy kujela other areas ko kene ke luiti nya bala ka cha tingun ke microbiology in ke specialization de to where that no cha ko ye wrong title ya go cha le psychiatrist ye ne microbiologist in ke title de ke lui laboratory so in ke ko ke niara no anything to do with chemical ben jam tin red Quran kit kira gur abi jam kare environmental pollution kujela environmental degradation caused by this we can in banya gur in kira gur in ke yana ni are ya bekere plot mati because na mere plot ni ke chat to kare oil kwa chi ki dir chola pa na la mane chi lu affected including part of the bargadari e mane run kene kiran ji bela to yi lang na ru wen ti kiran ji la to ko jare ke bai ko che ke chiro kon lo in the east so kene ke big deal ya ke lo imagine da na ye piu ku ye ke jo ko on the ground e dil de de ku miyo ka lu plot piu ni ki et non ji dong man de ko ke le ye ne ke le no oil producing area no abi laga ti tu ban ter yin da ne le ye ne ka chin bi yo ayo gi e ka tu man do nga le tin ayi egyptian man ke lui lai e piu ke what e kan ngal abe ke yo ka so e ngane sep man e ngane sep atome ti ka reji wa ekene abi ngeke de jo ating tinga wak ba intellect for introduction abu jo ben mi lo ele nyak Dr. Akuot Dr. Malual to ngwado ke dai ten ke yin kin yin ya je problem to one confusion aki ku define kwa book jo ben define jo topic jo la gain topic aka chin ki nya balaj luel ka chin ki banki ni chin ki luel yi yene ye document ju to ki ye man jam no wege lakin daman na jog dak wo chu ka le banki ka le ko le gi ne ban ko ban nya balaj jala di to ko ngore ga dai behind the scene so chokron
na pet baguna ala ba wak yo taw den din binatio wala bukti ga is okay o jo barom
ya di ba fay kakin ko audio kamana ba ke jo ba fix no mi kila
okay
ka ki mata ke ka la kina yo ka chin audio
Goodbye. Oh.
Yen wo buka jo ba chol bangan jom
Sama ganja planter, call me the ganja farmer. Deep down in the earth, me put the ganja. Babylon come and light it at a fire, me a chant. Yes, I'm a ganja planter, call me the ganja farmer. Deep down in the earth, me put the ganja. Babylon come, big stinking helicopter flow through the air. With them call it weed eater. Them never did it when me was out in water, or when me did implying fertilizer. Yet out of the sky them spitting fire, and I'm a little youth man with a hot temper. Me dig up me stinking rocket launcher, and in the air this was the helicopter me a chant. Some ganja planter, call me the ganja farmer. Deep down in the earth me put the ganja. Babylon come a lot it at a fire me a chant. Yes, I'm a ganja planter, call me the ganja farmer. Deep down in the earth when me put the ganja. Babylon come, yeah, tuna man. True Jaja bless I with no for good vibes man. And true me have the hardest set of ganja in the land. Make doctors get no meditation, and so them coulda give it to them sick patient. Make chemists get no meditation, and so them coulda brew new medication. Make singers get some inspiration, and so them coulda spread your message on the land me a chant. Yes, I'm a ganja planter, call me the ganja farmer. Deep down in the earth when me put the ganja. Babylon come a light it at a fire me a chant. Yes, I'm a ganja planter, call me the ganja farmer. Deep down in the earth when me put the ganja. Babylon come, watch out. Come and say ganja, 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 ganja. If you don't want to call it that, call it sensaminia. If you don't want to call it that, call it marijuana. If you don't want to call it that, call it the indica. And from me bun it in a chalice and rush it a paper. Lord, see me love me ganja. Some ganja planter, call me the ganja farmer. Deep down in the earth, when me put the ganja. Babylon come and light it at a fire me a turn. Yes, I'm a ganja planter, call me the ganja farmer. Deep down in the earth when me put the ganja. Babylon come, well it's like 10,000 Babylon in one blue van. Walk up Chester on this small damn ganja land. 10,000 Babylon in one blue van. Walk up Chester on this ganja planter, call me the farmer. Deep down in the earth with me money ganja. Pull on me ganja, ganja, me ganja. Loud the ganja, ganja, ganja. Me ganja, ganja, ganja. Loud the ganja. Ganja, 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 loud ganja, ganja, ganja. Sama ganja planta. Sama ganja planta. Call me the ganja farmer.
Video ba chưa thiếu banyak ber banki.
Yes.
Ka little bit slide show ishi karang cheloi baden video ajit baden the sound and chitao in the background kana che good ke yin pet betao ke tao nun te audio un te ya emotional situation te re chero loi pin dan jinu dan re ko jun te pin den nyoke en talking ke nyo de turat ke. So sound, I apologize for that sound. Actually good to be honest. Ra nó lối sound system cái này cái bên mà tek ba lại again gear của bác chúc kuna ja kila ben lum ya wanya ba like presentation about your ben lối wa ya cái cái ga nyu cái evident negative impact cũng thể chi oil pollution lối cái cái jo ben nyu bo cha cái jo ti ka chero lối để we un chen pin chen in tam mun ka cái tin thế này có cái tàu the team is here when a best defect all these stuff chin kaliu kwa yin obu ko jiten win ba pal futa go be there time go pando obu jo be yo presentation about your best lawyer ya ti karang men yo chi yo go ga dam je bok ben yo wala ka ji contact
Well, that it came to my. I said, "Town of Kong, you know, about that." Okay, you.
okay yin je le yo apology and then te ke ni ben yo karang chi yo go till ba gen jo be the cable ben yo wala ka ji contact
Well, that town of Kong, you know, about that. Okay, you.